every student. I'm start by praising Allah subhanahu wa ta'ala as He deserves to be praised. So in this lecture in the pharmacology, I'm start by the poisoning, that's like toxicity or the principle of toxicity, that can be defined as the 3 or the 4 steps I can manifestation at this moment. So this toxicity is derived from the toxic and the logics. It's defined as the study of the science which is deal with the desirable or an undesirable or adverse effect that with the chemical agent. And also there is 2 or the 3 definitions of the toxic. Again, the second definition in the toxic, that means it's defined as the toxic or the toxicity as a study of the science that is deal with the symptom toxicant, and also the management and the diagnosis also, and also the lesson if treatment, and also all these is the toxicants, that's chemical agents. And also the father of the toxicity of the toxicology is said, the father of the toxicology, his name is Theo Phillips. That man is said the chemical agent or he said all the chemical agent is toxicant. That means there is no chemical that does not have any toxicity. So according to this scientist, the father of the toxicity, again we have the classification of the toxicity, the type of the poison or the toxicant. There is 2 to 5, from 1 to 5 existence or the toxicant. The first one is the drug medicine poison. Again, the second one is the household, that means, or the example of the bacterial or the salmonella or the called the bacterium food poison. A second one or the third one, that is agro, or that is called the agriculture of the poison. Again, there one is called the hydrocarbons. The last one is the heavy metal. There is also the some definition or the divided into 2, the organic and inorganic. And the last one of this type of the poisonous, that's called the atmospheric plant. The atmospheric pollution, that is also divided into 3. The one is calling primary, and second one is calling secondary pollution, and the third one others. We come to discuss this thing, the primary pollution. There is some definition or the some subdivided in the primary pollution. The first one is called the carbon monoxide. That is 52% of the pollution or the poisoning. The second one on this subdivided is the sulfuric side. The sulfur dioxide is 14%. Nitrogen oxide 14%. And then come to subdivided in the atmospheric pollution is the secondary pollution. Secondary pollution is the example of the sulfur trioxide and nitrogen dioxide and the sulfuric acid. So when the conclusion of the poisoning of toxicant, there is spectrum of the undesirable, that also there is some divided in desirable of indesirable. So in desirable there is 2 divided. The first one is calling side effect or non-detection effect. The second one in the same column, that is called toxic or detection effect. We come to divide the side effect or non-deleterious effect. Non-deleterious effect that's having two example, or that means they do not have any determine or determination to effect. That means the two example of non deleterious effect, that's one is calling the morphine and the second one is belladonna. When come to define or the side effect of the morphine is cause the constipation and the constriction of the pubis, which are the most common in the side effect. So the side effect that's mean here in the morphine is having the non-deleterious effect. So we come to some second example, that is belladonna. Belladonna, that's maybe cause the dryness of the mouth in the side or the outside of the mouth. That is called the belladonna. This is cause this one. This one of the side effect. We come on to toxic deterioration. Toxic or deleterious effect. They are to produce when the dose of the extremes with the treatment unduly prolonged. So this also having the two example, prolonged of the streptomycin and also the paracetamol. Okay, this lecture it's talk about the toxicity or the type of the poison and the definition of the poison, and the finally is spectrum of undesirable. Thank you to listen to my lecture. So I'm a student of the pharmacy also. So now I have to give the some manifestation and some definitions and desirable of the pharmacology. Thank you to